And we started thinking about what were some of the things that are so often ignored by health professionals and people with cancer. And we came up with a list that included the following. One was, don't be rushed into treatment. You know, so often patients are told, your tumor is malignant, we've scheduled you for surgery and chemotherapy tomorrow, or whatever it is. So the first rule was, don't be rushed into treatment. There's almost always time, unless it's an emergency, to emerge from shock and really ask yourself about the options, because you may have to live with the consequences for a long time. The second rule of thumb was that reading the pathology report is the weak link in cancer treatment, because people read pathology reports differently. And so being sure to get potentially several readings or different readings is, you know, an important dimension of cancer care. Just starting with those two, what are your thoughts on those? What are the rules of thumb that you would have for cancer patients broadly in terms of medical treatments that would help them get the best counsel?
Well, I think you're starting with the second one first. I mean, you know, yeah, definitely you have to have a good pathologist review the slides to make sure, number one, that it's cancer, and number two, that it's the grade and the stage of cancer that they're saying it is, because that definitely impacts outcome. I mean, I had a friend who had a bladder cancer that one person said was superficial and another person said it was invasive, and it means the difference between having your bladder removed or not, and that's a big difference. So, you know, ultimately it wound up not to be one that required the removal of the bladder. So, you know, if you're having your surgery done down the street here and the pathologist at the community hospital reading it, I would probably send it to a cancer center or university hospital for review. I think that's a good piece of advice. The speed with which one undertakes treatment, I think when people hear you have cancer, as you say, they're shocked and they feel their locus of control is taken away from them. And a way to give it back is to, you know, just take a breath, slow down, and seek other opinions. Because as you say, it's often a very significant life-altering and body-altering choice that needs to be made. So, you know, I see patients who go around the country to the major cancer centers getting advice, and sometimes that's good if all the advice converges on the same recommendation. But if you get divergent recommendations, which many patients I see who see more than one integrative oncologist might be more apt to get divergent recommendations than people seeing the same expert in that particular cancer, where there's more of an evidence base. But I'm just saying that sometimes it paralyzes people if they get too much input.